I think that when it comes to the inflammatory disease spectrum, and particularly these autoimmune conditions, the one really wonderful thing is the innovation that's come into the market. And, I started in 2006. I got to see, Humira and Enbrel come into the space, which was very unique. And you really watch the evolution of the science to the point where we just got a lot more narrow focused. We were able to actually treat pathways instead of broad spectrum. And I think when you do that, as you know, you can increase the level of safety, and with that, confidence. So it really, we have this unique ability now to really reach out and make very, very impactful differences on these diseases. The education is there, the understanding of the comorbidities has been discussed before, for the necessity of actually reaching out and increasing that level of care to systemic therapies is well known. And so I think that, industry, the pharmaceutical industry does a fantastic job of giving us the resources and the education, both through the medical science teams and as well as the commercial teams, so that everybody has access to these drugs, not just providers as far as the knowledge, but also patients when you start talking about the patient assistance programs and whatnot on formularies. So it's really been a wonderful evolution. I think that you start to kind of see, a rising tide raises all ships. You start to really see the elevation of standard of care. We've improved the mindset and the approach and maybe the appetite, if you will. We've gone from PASI 50. Now we really don't look at anything that doesn't hit a PASI 90 or a PASI 100 even. We're raising the bar. So we're in a great place. And atopic dermatitis is falling right into that now in the golden age. We have all these new therapies coming out with that. So I think the people that are just coming into it probably don't realize how lucky they are. But the old heads like us, we've gotten to see the transformation.